Welcome to a nighttime show. This is our expert speaker series where we sit down with people who know the system from the inside. Tonight, we're exploring healthcare. In a previous episode, we heard from a guest who shared his first-hand experience as a Medicaid recipient, navigating dirty hospitals, struggling to find culturally competent providers, and feeling like just a number in a system that should care. We also heard from another guest, a Medicaid provider who struggled to get answers and reimbursements from insurance companies. Today, we're continuing that conversation, not just with another perspective, but with someone who understands how policy decisions shape those very experiences. Joining us is Amira, and she's going to introduce herself.
Hello, everyone. My name is Amira Iwuala. I was born and raised in Boston, Massachusetts, in a neighborhood called Roxbury. I have a background in public health. I really do care about policy advocacy, especially about advocacy for anti-poverty and anti-hunger work, and really just making sure that policies are centering people in place, making sure that they are really bringing the realities of people that are most impacted by policy, being those that are most marginalized as well. So very happy to be here. Very happy to have this conversation. I do think that policy can be a really good enabler in making sure that healthcare is making healthy easier choice for people, especially if they do have low to moderate income. So very happy to be here, and thank you, Harper, for having me.
You're welcome. So, yeah, we're excited to have you here and we're excited to hear what you have to say. So, let's dive in. So, Jarel shared how making healthier lifestyle choices, such as eating healthy and exercising, improved his well being.
I learned the importance of being healthy. So I started to watch my weight. I started eating healthier, started drinking more water, started to exercise more. And my family, for the most part, they didn't really live that same type of lifestyle. So it was difficult for me to try to implement that. But I also noticed like my anxiety started to get better, my depression started to get better.
How do issues like nutrition and food insecurity shape people's healthcare experiences, especially those on public programs?
Yes, thank you so much for this, and I really appreciated his vulnerability on sharing that as well. Um, as I want to say, as we know, but the access to like nutritious, tasty, and culturally relevant and affordable food um, really supports people's health outcomes. Like when people have access to nutritious food, they will probably have better health outcomes. They are better able to handle any of their maybe diseases or sicknesses that they may be dealing with. We know too that they're able to better adhere to their medication when they have access to food. So food and healthcare go hand in hand. We're seeing a lot more even hospitals join programs like food is medicine because the fact that they understand the power of food and healthcare. You can't just give people medication and they don't tell them that they have this diagnosis and then they're telling you, well, at home we can't afford food. So I think like overall, which is really great to see like policies and policymakers are understanding the importance of really connecting food and healthcare and making sure that people are not having to suffer from malnutrition because they don't have access to fruits and vegetables. So we are starting to really understand that connection between eating healthy and also have an environment that promotes exercise and just overall how that connects to well-being. So I think that's a very important thing to acknowledge. That food insecurity is not only connected to physical health, but it's also connected to mental health. And I think when we talk a lot about healthcare, we kind of do focus on physical health because we think about, okay, chronic illnesses like diabetes and hypertension and types of cancers. And we might not think about a lot of these mental health conditions that might be the root causes of trauma and like PTSD. and a bunch of other like mental health ailments. And I will say too that we really overlook that living in persistent poverty, not knowing how you are going to pay for food, how you're going to pay for a roof over your head, for rent or anything, also is a traumatic experience. Like poverty is trauma that really kind of increases a person's risk of having poor mental and physical health outcomes. So it's really important that we really are understanding how nutrition and food security is really connected to healthcare. And actually, the CDC actually found that 90% of the nation's $4.5 trillion in annual healthcare expenditures are related to people with chronic and mental health conditions. And chronic and mental health, well, some mental health conditions can be prevented, especially when we focus on chronic. We know people have access to healthy food if they're able to exercise, if they have decreased stressors in their life, and poverty being a root cause of that, they will probably not develop chronic illness, especially at younger ages. So it's really important that we understand the power of food and nutritious food and healthcare and really make those connections. Sometimes people have to forego paying for medication for food. Sometimes people have to forego paying for food and medication to pay their rent. So again, just the connections of we have to make sure that people have the resources they need to live a healthy life, and healthcare plays a huge toll in that as well, a huge role in that. And the last thing I'll mention too is that, at least on like a positive note, in many states, there's called things like dual enrollment. So when you find out that you are eligible for Medicaid or for SNAP food stamps, you're able to be automatically enrolled in both. So that's great because there might be a time a person might not know. They're like, oh, I actually was eligible for SNAP. Like now I can go enroll. Or like now I have access to food and I have health care. Someone might lose a job and then they find out like, oh, I have access not only to SNAP, but I have access to health care. Something I have not had and I've ignored. So I think it's really important for us to continue to make these connections between healthcare and food and making sure that every person has access to good food in the States.
So Jarel talked about struggling to find a provider who understood his background.
You don't always get a lot of different options for your provider. So you may get a provider that doesn't really have the same background as you, and they might only have that provider. So if I have somebody who I'm not really vibing with, it's difficult for me to get that help from them. And since Medicaid doesn't give you that many different options, you kind of just stuck with that person. I don't always get a provider with a similar background as me. So when I am explaining things, it kind of feels like I might be getting judged, or they just don't understand me at all. They don't really know the best approach to help me out.
Well, that sounds really difficult and annoying.
It is for sure.
Why is that still so common for Medicaid patients?
Yeah, thank you so much. That's a tough one. I think for the first part, just to talk about like a systemic issue that I do think can be like better easily fixed. I do think there just needs to be a lot more like diversity like amongst physicians and like medical providers, and that can be a lot more how do you say, like up the river. So like as we think about making sure there's a lot more enrolling in for medical students that are of color. So we need more Black, Latino, Hispanic, Asian, and all, like, you know, providers that are being supported through medical school and retained during that time, and then also maybe providing them with incentives and encouragement to serve in practices or hospitals that are providing care to Medicaid patients. So I definitely do think that like might be a larger issue. I think I'm now a lot more people, even me, like I want a Black woman provider, and sometimes too, I will ask like, yeah, I'm looking for a Black woman. Can you help me find that? So I do know there's really importance of people wanting to finding someone that looks like them and having that trust built. So I do definitely like sympathize with Jarel in that, and I do think that is a systemic issue that can be fixed if we really do better invest in our medical career professionals to encourage them also to serve Medicaid patients as well.
Jarel also described feeling like a second-class citizen with long waits and poor facilities.
Yes, so I've noticed in the African American community, We don't always have the same standard of care. So an example of that would be hospital that's in the black community. I've noticed that the ER tend to be dirty, overcrowded, and understaffed. So you might come in there just for a broken finger and end up waiting 6, 7 hours just to get that finger x-rayed. Then have to continue waiting for the doctor to come in and to get a prescription written for medicine. So it takes all day. You sitting there suffering, dealing with other sick people coughing near you. They don't clean it up all the time. So it's definitely something that I would love to see change.
What systematic issues lead to that kind of experience?
We also do see that a lot more Medicaid patients are usually going to things like something called like a safety net hospital. And safety net hospitals are hospitals that predominantly are serving underserved areas. So a lot more of their patients are Medicaid patients. They're people that are uninsured entirely. They're people that might have a lot more chronic conditions and can't actually afford care. So, and these, unfortunately, these safety net hospitals are hospitals that are also usually way less funded. They experience a lot more infrastructure issues. They have a lot more issues with staffing and turnover. And I do think there are connections in between the fact that since these hospitals are underfunded and have less resources, their providers are not as supported, so it increases turnover. Also, a huge theme of this, as we talk about, is like, Medicaid reimbursements being a huge issue. Like, we got to do better with this. Like, Medicaid reimbursements, as Jarel and Alicia mentioned in the past podcast too, like, they're not meeting the need. They're not high enough. It's really kind of disincentivizing a lot of providers to actually provide care to Medicaid patients, because I know that, like, well, this is not going to be fully reimbursed. The hospital, not saying they're being driven by that money, but the hospital is not going to get that much money, that much funding from these patients as well. So that also increases turnover, because there's just not like longevity in that hospital. So when there's a lot more turnover too with providers, there's less trust built. Like, Jarrell might find a provider, and then that provider will leave maybe like in less than a year. So that's now an annual examination that he has to find a new provider. Not that's not a great feeling. That's not like you really building a trusting relationship with your provider. Growing up, I also has always been on Medicaid, always been a Medicaid patient, and I remember yearly, I would never. People would always ask you, "What's your provider's name?" I could not tell them because every year I had a new provider, and then now actually understanding kind of the systemic issue of it, I understand. Of course, I've usually was always going to safety net hospitals, but yeah, so there was always a new provider, so it was kind of hard for me to remember like who my provider was. And then now realizing it on the policy stands and understanding how hospitals are actually operationalized is just the fact that they just did not have enough money to really retain good providers. So that is a huge systemic issues as well. And also, these providers that are working in safety net hospitals, they are working in way more higher stress environments. They're a lot more burnt out. And then there might be also just less professional development opportunities. So it's not really incentivizing them to really want to stay at a hospital that they might not feel is completely serving them back. So I think that is important to really invest in these safety net hospitals, and really to decrease the rates of turnover as well. And then to get to the point of like long wait times, we hospitals usually see, or patients usually experience long wait times because there's not enough providers. So again, as we're talking about, providers are being burnt out, they're leaving the job, they're not staying. That's increasing wait times for hospitals because there's just a lot less providers that's available to patients. So even though a person might just get Medicaid and they won't be waitlisted to get Medicaid, but now it might be months and months and months for them to actually get their first, just wellness visit, as a Medicaid patient, because their hospital just does not have enough um, appointments because there's not enough providers, and that is one of the most like frustrating things as a patient, to really have to feel like you're booking out months in advance when you might need answers now. So that is a huge systemic breakdown that I do think we need to fix as well. Um, and I also wanted to, I know a lot of our work in healthcare, as we think about it, kind of focuses more on like urban areas. We also need to focus on our friends in our rural communities as well. A lot more rural community members are on Medicaid. Just the reality, because of a lot more of them are working in low wage work, are experiencing poverty. We also know there's not as many hospitals in rural areas compared to urban like epicenters as well. So as we think about, the difficulty of maybe you're in an urban area trying to navigate your healthcare system and get an appointment and experiencing all this turnover, thinking about living in a rural area that might have one hospital that's even so far from you that you have to drive and travel to and really plan, and then you have a very more limited amount of providers, because also these urban areas are kind of low-key taking taking a lot of the providers as well, because there's a lot more work in I would say money or pay that are in urban areas. So just also wanted to throw that in there, that there are also unique challenges that rural communities experience when it comes to navigating Medicaid and navigating practitioners that are not going to be there in the long run, and then also feeling like a second class citizen. Um, as well. And sorry, I know this is a little jumbled as well, but I just want to mention about the poor facilities. Again, this might not be like the entire like generalized experience of every Medicaid patient. That like, oh, you're feeling like you are, when you walk into a hospital, you can just tell that you're a Medicaid patient. But I've really heard and I've experienced this myself, where being a Medicaid patient, you just kind of feel grateful that you are receiving care, because you know that you're low income, you know that there are people that might be paying a lot more out of pocket, and luckily you're able to really decrease the out of pocket cost to you. So you're just subject to having to accept the bare minimum, the bare requirement of healthcare provided to you. I think that's also kind of what like Jarel was feeling like too, like feeling like you're in a center that's dirty, you're seeing like all these long wait times, like you're just feeling so uncomfortable, but you don't really have that agency and choice to like up and leave the place, because you know that this is the healthcare that are you are subject to. So that is a general experience. And again, because a lot of these hospitals are underfunded, they're not able to really update their facilities. They're not able to really, enhance their facilities and make maybe a more welcoming healthcare experience. But that is a general real feeling of being a Medicaid patient, feeling like kind of a little disgusted by being in a facility because you are low income, don't have income, experiencing hardship, and this is the healthcare you're subject to. And that is a issue as well that should be addressed.
It sounds like if you're saying that Congress is the one that holds the purse, they're not empowering their citizens. Mm-hmm. They're not really taking care of them, or maybe making them a priority. Mm-hmm. Or maybe if they are, there's something blocking it from happening. Yeah. Maybe miscommunication within Congress itself. Yes. But it does sound like figuring out a solution would need to happen sooner than later, because you don't want your own citizens struggling, because that really weakens a nation.
Yes, definitely. And I think a lot more members of Congress needs to listen to, or at least create avenues to listen to their constituents, and that means that their constituents that are on Medicaid, and understanding that as well. So yes, a lot of your constituents are not feeling empowered in a health way. They are feeling very subject to poor health outcomes, and that's just their reality. And I do think that Congress has the power and will. I have faith in a lot of policymakers that do care about this, to make this happen. So really do encourage that, and encourage Medicaid patients to speak to your member of Congress and let them know your experience and talk about these realities, and take your time to reflect and know that you deserve dignity when, navigating healthcare as well.
I worked with some other Medicaid plans where we did everything right and still didn't get paid. And I've spent so much time doing spreadsheets and phone calls and emails and meetings, and I will go unnamed, but a specific company they owed us a lot of money, and it wasn't, again, had to do a lot of pushing and trying to get people to help advocate with me. And I'd say we got about 50% fixed. And the last email I got was, well, we're not going to review this again. And my response is, well, but you processed this wrong, right? We've done everything right. It was a processing issue, which happens. You need to fix your mistake, and they won't. Which has led us to really limit which plans we'll take, which again hurts, because I know that I'm not the only provider having issues. And so people who have those specific plans now have one less practice that will see them, and that sucks for them.
Alicia also said that billing rules changed without notice, which led to mistrust.
Sometimes we got people who said, I don't have no idea what the problem is, call somebody else. Had we known that associate license and student level could not bill, we wouldn't have kept doing that. And so it was a learning lesson on my part that you can't always trust, right? And like, I should have done a better job reading through the literature and figuring out, not just necessarily trusting what we were being told, but who has time for that, right? Like, I'm trying to provide therapy and I'm trying to support my employees to provide. It's feels broken is how the system feels. And I mean, the truth is the rule was always there. It's just not one that we found or understood, and it's certainly not one that people answering the phones understood.
How can communication improve for providers working in these systems?
Yes, definitely hear that. We need a lot more technical assistance for our providers on the ground. There shouldn't really be a reason that providers are learning months to a year after policies have been changed, that this will be like really affecting their reimbursements. This will be affecting how their services could and should be rendered. So there does need to be a lot more communication from the federal level, as in the people that are making the policies in DC, and then to the state level, the people that are administering the programs through the health departments or Department of Health and Human Services, and then down to the insurance, and then down to the providers. Like, there needs to be that, like, like chief health strategist to really support that. So I do think there needs to be investment in that, investment in technical assistance, and that can be either an entire role or position in these departments of public health and health and human services, or it just has to be better resources, and really translating, these complex policies better to the ground level. So it's one thing to feel like, oh, you know, the administration and Congress did its job by, changing this policy and thinking like, oh, this looks great. This is gonna actually help people. And then on the ground, it's not being actually implemented, or they're finding out late. That also discourages patients from wanting to receive care, because if they're on the phone with their Medicaid provider, or there's like with Medicaid itself, or any insurance that has to deal with these changes. And then imagine the agent not knowing there's a change to the insurance. You're going to start doubting everything about life. Like, well, if my provider and my insurance doesn't know the change, like, why should I pay this also? But also, like, why? There's no trust in your provider if they do not know that there's a huge change that happened to the services that they could render you. So I do think there needs to be an emphasis on that we need a lot more technical assistance to support our providers, and to support our insurers as well, so that they know if there are changes with reimbursements, in that whole paradigm of that as well.
Thank you so much for being here today,
Thank you.
Amira. Before we go, where can people find you and follow your work?
Yeah, you can follow and connect with me on LinkedIn, Amira Iwuala. I think it'll be like put in the description. And then on Twitter, it's Amira Iwuala. We'd love to connect and we'd love to engage. We'd love to be a thought partner in this movement to really, make some change. So yeah.
Awesome. And yes, I will put the links in the description below so you can easily find her. Well, thank you to our listeners for tuning in. Have a great night.